are.
It's cutting edge, it's controversial, and it could be the future of cosmetic surgery. A local doctor has perfected the procedure to make you taller. In a CBS 12 exclusive, Eric Roby shows us why people are lining up to undergo the painful surgery and why the doctor behind the breakthrough is always reluctant to do it.
Kevin Kadeckia is living large, a second-year med student at the University of Miami. Everything is going his way.
I guess it made me feel better about myself.
When he was 18, he underwent a limb lengthening procedure, both legs broken, then stretched over time. His main reason for doing it? Women.
You know, I was 5'2". You know, the average girl in America is like 5'4".
To grow taller, he had to have 4 fixators like this attached to his legs, constantly stretching his broken limbs. Just like these patients, after surgery, Kevin underwent 6 months of painful physical therapy.
It's the most aggravating pain you could ever experience.
The cost of the procedure, $70,000. The physical therapy, 2 hours a day for months. In Kevin's case, he grew 4 extra inches. Put it in perspective, this is what I would look like if I grew 4 inches.
The demand is huge.
Dr. Paley is the pioneer in the limb lengthening field. He just moved his world-renowned institute to St. Mary's Medical Center. The vast majority of his time spent helping children with birth defects. At first, little Eva Davison's parents were told her right leg should be amputated.
Good job. Get that heel down.
Dr. Paley not only saved her leg,
Good job. Inside. Yeah.
but after a few years and multiple surgeries, it'll be the same length as her left leg.
Big steps.
I love watching this.
Dr. Paley only agrees to do cosmetic surgery on about 10% of the people who request it. He also requires a psychological exam. Even after that, he's still not comfortable with his procedure being done for non-medical reasons. But
It's going to happen with or without me.
since he basically created the procedure, he feels responsible and wants to limit the number of patients who are injured by less experienced surgeons.
People have created disasters. We'll make sure that the techniques that I've developed for it are reliable and reproducible and safe.
But Kevin couldn't be happier with his results.
Well, it helped me get her.
Kevin knew his girlfriend before his surgery. It wasn't until after he grew to her height that she started dating him.
It sounds horrible, but I don't think I would consider dating someone who is shorter than I am.
Dr. Paley may not agree with most people's reasons for cosmetic limb lengthening, but the results are hard to argue. Despite the pain, the money, and the time, Kevin says he would do it all over again.
I would do it without even thinking.
Dr. Paley believes that despite the risks, many more surgeons could soon offer this procedure. He only hopes his expertise can prevent patients from being hurt or even crippled. Pretty controversial, you know.
Yeah.
Maybe in the future would people do it so they can be a better basketball player?
That's interesting.
Or maybe like a model, because you know you have to be taller to be a model like that. So it just kind of opens up a wide range of questions.
It does. You know, what I wanted to know is what the leg looked like. Does it look different? Are there, you know, I don't know. We didn't find that out.
Well, thank goodness you don't have to be tall to be a weatherman, because the first thing people say to me is, wow, you're not quite as tall in person as you are on TV.
Same with me.
You know, in the TV though, you're always about this tall, right?
Yeah, from here up, they don't know.
19-inch diagonal.
Here we go on this